Thank you for joining us for this week's cross-industry Safer at Home weekly update. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. And I want to thank you for continuing to join us for these calls, ask your questions, get your updates, and provide feedback. Please excuse me today. I do have a cough, but luckily since we're on the screen, you won't catch it from me. Please put your questions in the Q&A in the chat, and I'll ask them on your behalf throughout the program or after Lane's done giving the updates. This time, I'm going to hand it over to Lane Drager with Boulder County Public Health.
Thank you, Corinne, and thank you everyone for joining. We're here again this week to give you some updates and mostly spend time answering any questions that you may have. So what I want to cover today is let you know where things are at with our monitoring efforts related to COVID. Those details related to our EPI focus. Talk a little bit about public health, and there's been some slight adjustments in mask orders locally, but more to make things aligned than to be problematic. And then definitely have plenty of time for you with any questions that you may have for us. So this is a graph really since the beginning of May, looking at the number of people who are testing positive for COVID. So of all the people tested, we want to see this number be obviously as low as possible. And really we've seen a steady decline since May, and then really a nice marked drop off in the last month. So we're seeing very low rates here for COVID of the folks that are testing positive. This is especially important to note. I know a lot of people have been concerned about CU reopening and all the students arriving on campus. And so there was a very proactive effort to test students. And as a result of that, I think that also helped drive the numbers down because they saw very few positives out of all the tests they did. And between the folks that had already been tested and the ones they tested, there was about 6,000 students that were tested. So again, we're seeing incredibly low positivity rate, which is very good. Then this is a graph you've probably seen if you've joined us in the past that we're continuing to show. And this is our 5-day average of new cases. So you can see some of the outbreaks that we've had over time. And really this wonderful decline since kind of the end of July throughout August, we've seen a good marked decline in our 5-day rolling average of cases. So that's a very good sign as well. So again, wanted to update you related to the public health orders, specifically the local mask orders. So the city of Boulder has updated their mask order and making it now to fully align with the Boulder County Public Health order. So there's no differences between the two. And the city of Louisville has also tweaked theirs. It may not be fully in alignment, but it's much closer now, focusing on the age at which people are required to wear a mask, both indoors and outdoors. And so that's set at those older than 3. So again, those are hopefully help people that we know that it's been challenging to navigate the various orders. So hopefully this helps a little bit there. Still want to make sure folks have the resources. The chamber, our website has mask signs you can post, and it's really important that you're doing that. Also, the idea of providing alternatives for those who can't wear a mask because of medical reasons. So again, setting specific opportunities depending on your business where you maybe can accommodate those folks. But again, it doesn't mean that folks who can't wear a mask can come to your business at any time. And certainly folks who refuse to wear a mask can be denied that service too. And then there's this hyperlink to the state mask guidance for you. This will be probably easier for you to see in resources as you go, but this was something interesting that I wanted to share with you, that just across the state, there's a whole variety of things happening related to masks. But so I thought this was interesting for those of you that may have businesses across the state. But just some additional resources in case you do have facilities outside of Boulder County. Oops, get double clicked. So this one, again, might be a little easier to read, but I thought it was really important for you to see what some of this stuff means. But we've done audits in the past, and this is our most recent audit looking at our compliance for people wearing masks, as well as folks social distancing. And this was, I think, wonderful to see that we're seeing really awesome compliance. So you folks running businesses are doing a great job. We're seeing good overall social distancing and really high mask compliance. Not that this was a competition, but the retail sector was the overall winner at 97% of their facilities that were audited. We're seeing mask compliance. So that's great to see. And really some of the areas where we saw a little bit lower numbers, and again, the overall that even brought the numbers down, were really instances that likely did not require a mask. So restaurants, if the volunteers who were out there saw people not wearing a mask, it very likely was because they didn't need to if they were eating or drinking. Similarly, in parks, if people are able to social distance, they again don't need to wear a mask. So again, some of those numbers are skewed a little bit there, and we're going to try to work with volunteers in the future to maybe tease some of that out, so it gives us a more true representation of instances where people need to wear a mask, were they wearing it. Again, here's more information for you across the county where of the 60 sites that were visited, where those were at, and again, what kind of compliance they saw. This final column that was in the last chart and this table as well was related to sort of a Likert scale, where you're looking at from 1 to 5, how much did we see crowding versus really good social distancing and spread out. So 1 would mean that it was absolutely crowded and nobody was distancing, and a 5 would mean everyone was at least 6 feet away and there was no crowding at all. So again, overall seeing very high rates of people social distancing, which is great to see. We've been talking about protect our neighbors. Don't intend for you to read all this. We do have it on our site, so you can read all the 9 metrics related to that. There was a little bit of a backslide. If you have been tuning in, we had previously met 6, and now we're only meeting 5 and partially meeting 4. So this is just, I think, mostly for you to see how we're doing overall, which again is fairly well, but there's still pieces of things we would like to see in place or metrics that we are not meeting. This is not really intended as an overall effort for us to move to protect our neighbor, but it is a good benchmark of how we are doing overall. And those are the main updates I wanted to share. So we're gonna have plenty of time for you to answer any questions you want. Again, want to do a reminder of our schedule. So we do have this general session every Wednesday at 3. And then we have our special session at 4 o'clock. Today's session is going to be related to Parks and Recreation. And then we do have our Spanish language session for any of those folks that may be a helpful resource for. And all of our past recordings, again, are available on the chamber. And there's a hyperlink at the bottom there where you can get access to that information. Certainly, if you need to reach out to our team, we are maintaining that COVID Biz email, and the call center is available 9 to 2, Monday through Friday, and there's the number for the call center. And with that, happy to answer any questions folks have, anything that you may be struggling with.
Okay, we have a couple questions that came in. Can you clarify what changed with the City of Boulder's mask order?
The main overall change is that it aligns completely with the county's order. So there were some age discrepancies at when people needed to wear a mask, and so now everything is fully aligned. So that age is 10 in our orders. So I think that was probably the biggest change, but there's not, we do, I think, have a mapping of the orders of what they require as a link on our website too. So we can work to make sure that that's fully updated and share any other issues you have.
And then you mentioned the protect our neighbors, and we were meeting 6, and now we're only meeting 5. Which is the one that we've now no longer meeting?
Let me go back. And I don't know if I'll have that as easily. I'll tell you which ones we're meeting. That might be easier for me because I don't have last week's memorized to know which 6 we were meeting. But we continue to have sufficient hospital beds. Again, that's not a demographic we continue to show you, but overall we're seeing, again, very stable utilization of those hospital beds. So that's very good, especially as we head into flu season. And obviously there's lots of viruses. Corinne's victim to one of them, not COVID, but so we know there's stuff in our community. We do have sufficient personal protective equipment supply. We have stable or declining COVID-19 hospitalizations. We have sufficient testing capacity and documented strategies to offer testing to close contacts. The things that we have partially met are fewer new cases. We did see, that's probably the one that, as if you saw, it had tailed off and then it just slightly spiked back up. We have partially met the ability to implement case investigation and contact tracing protocol. Again, as far as robust resources of where we might need to be, that's still something that we do not have full capacity for. Documented surge capacity plan for case investigation and contact tracing, partially met. Mitigation and containment plan developed and finalized, which is also partially met. And then there's nothing that we haven't met at all.
And as a reminder, I'll continue to send out the link to the Protect Our Neighbors tracking. You can live track where Boulder County is on these different metrics. So you can also see where we are at any time. We appreciate the update each week, but if you have a question or want to see, you can also go to that link. What is the recommendation to employers as employees start to travel in terms of returning to work? We're assuming that they're asymptomatic. Does the advice change if they go to a higher risk area or a lower risk area?
There is no current requirements within the orders related to travel. Certainly it's more related to exposures. If you know you've been exposed or been around people who have, that's when we look at quarantine components, but just strictly based on people traveling, that's something that we don't have any restrictions that people need to, stay home for 2 weeks or anything like. It's very much still based on what you're doing with employees, looking at symptom screening and tracking those pieces, not related to just because they travel.
And this became an HR issue. So this came up, I believe, in June when we saw spikes in Arizona, Florida, California, all our neighboring states. And this question was framed for legal counsel, for employers counsel. And they gave us back a link to a blog by a human resources lawyer that said that if you say that somebody has to quarantine when they come back from a location, that you have to tell them beforehand, and you have to make that across the board. You can't just say one employee and not another to avoid discrimination. And you have to let them know before they travel. So I'll continue to send out the link to this advice given to employers about, when you can and cannot require someone to quarantine after travel, to help anybody that hasn't had a chance to kind of update their policies around this.
Yeah, I think it's again, there certainly air travel is going to be a higher risk, but just because people travel doesn't mean they increase their risk. So certainly if they drove somewhere and visited family, that's not necessarily that they've added tons of risk to getting COVID.
Yeah, I think the question centered around, a family trip versus going to a casino in Vegas, or at the time it was someone coming back from Arizona versus, going to Wyoming, whether it's a hotspot state or a non. So I think that a lot of that runs around HR and some legal advice, and I will send the links so that you can make those policies within your own human resources departments. So you presented some results, especially around the social distancing and masks. And I've actually heard this a couple times because I think some people saw your presentation at City Council and some other places. Can we get a copy of those results that I can share so business owners can see, the mask wearing results and some of those other pieces?
Yep, I can share that report that Megan created.
That'd be great, and I will share it with everybody on this call. Any info on when we might see inexpensive fast results tests available in our area?
There's quite a bit of testing already available in our area. I know there's also some free testing. We are seeing, I think, a lot better turnaround from labs where it was several months back. So haven't heard that there's still as much problem. There are a lot of different types of tests out there, so there is still variability with those as far as the timing of when results come back and as far as what the tests are best suited for. But if you're working through your healthcare provider, they should be able to have access. Our website also has a link of testing sites, and it kind of walks through the various pieces of those as far as which ones may have no costs, as well as if there's criteria. Do you need to have had an exposure, or can you just go get tested because you want to?
I think some people are actually hearing about CU's testing, the saliva testing, and some of that's not actually CDC certified quite yet. It's just an early indication tool that they're using, or is that even a tool that's available to others?
I don't think that's widely what's being used. There are some tests that are initial screens that then get referred for additional PCR type testing. So that's, I think, a piece of what's happening with some of CU's testing.
So I will send out the testing resources again. So the state has a site. So if you're not in Boulder County, there's also a site where you can go and look at anywhere in the state for testing resources. And then Boulder County has a page that talks about some Boulder County locations. And there's a few of our local hospitals and providers that will come to your business and provide employer testing as well. Any idea as to how many people have COVID who have chosen not to be tested?
I don't. We have our case counts. So in order for someone to be considered a COVID case, I think they do have had a test, but I'm not sure if there's other diagnoses that are happening short of a confirmatory test to be counted as a case. Certainly we have people that are quarantining or isolating in some cases because of exposures and things like that. But our case count will be the best numbers related to how many cases we've seen.
Are there any other questions out there from the audience? So I know you don't have a crystal ball. Any changes on the horizon from the governor, or anything you've heard may change? Or are we status quo for a while?
Always hard to say. I don't know of any changes specifically. The governor's orders are always a 30-day order, so that would be a piece looking at as that comes to its next conclusion for the state mask order, of that likely being extended for an additional 30 days, but we're still a little ways off from that curfew again. But have not heard of any other pieces. I know there's some additional discussions looking at trigger points, like for universities and some of the larger entities, of what type of activity might need actions taken related to, again, looking at CU, is if we saw really significant problems, would there be a point at which CU might need to go more remote or other activities like that? But we're not anywhere near any kind of trigger point like that. We're seeing very good, very low rates within the city and certainly within the university.
And then, you know, that protect our neighbors, the reason you're tracking protect our neighbors is because that is eventually the next phase, which would, you know, change some of the numbers. It would change some of those capacity levels. But again, that is in the future. We have to meet all those indicators. You have to apply. There is a period of time needed for that.
There is, and honestly, I'm not sure that we would even seek to apply, because it probably would open up too much. You know, it starts to open up 500 person points, which if something went wrong in a lot of those settings, it might be a point of no return and recovery. So we're very, very cautious about looking at some of those pieces, given the fact that we've seen what outbreaks can do under our current safer at home, even before things were fully relaxed, and how quickly those spikes occurred. So we're just being very cautious there. It also has a lot of hoops to jump through, and we're still, quite a ways off from meeting it.
Okay. We're also not hearing about bars reopening quite yet, or, I mean, we're still looking at, continuing to do symptom checks. We're continuing to, wear gloves when it tells you to, continuing to wear masks, continuing to limit capacities. All those updates we did months ago that, we may not be updating about right now. You want to continue that status quo until otherwise told differently, correct?
Yeah, I think we're really looking for the vaccine. I've heard some preliminary mentioning that again, they're looking at the various approval processes for those to see what the best route is to make sure that whatever makes it to market is effective and safe. So we need to see those pieces before we really expect to see relaxation in some of the pieces. But I would not expect symptom screening and looking for ill employees, those kind of things, to go away. They're really essential pieces. And I think I mentioned this on some of the past webinars. They've been incredible, effective tools to really catch, ill employees before you get a large outbreak at a business. So it's really been important, and they have been effective, and they're continuing to work.
So I have a question about office again, about mask wearing in offices. Let's do two parts to office. The recommendation for office is 50%. We want to continue to encourage, if you can work from home, to work from home, because you're hoping to continue to decrease the number of people, especially as we increase the number of people in our community with students and so forth coming in. We want to decrease the number of people that are engaging every day. So if you can work from home, continue to work from home, correct? You're on mute, Lane. You just
sorry, correct. Yeah, I think we would definitely want to encourage people who have been successful at working remotely to continue to do that. We also want to make sure that any employees that are high risk are given some accommodations, so that that's not happening either. That they're not coming in, that they have opportunities to work remotely when that's available, or look at alternate assignments that they can have so that they have lower exposure. And yeah, I think we also would expect, maybe the second part of your question related to masks, of when do you have to and when do you not have to, is really related to if you're only the only person kind of in that space, so you're in a closed door office all by yourself, you don't need to wear a mask. But any office where people are regularly coming in and out of, you do. If you're in a cubicle, even though the cubes are 6 feet apart, you still need to wear a mask indoors anytime, unless you're really alone.
Yeah, and I've sent out quite a few clarifications on that this week. As offices are starting to, look at that mask order and realize, oh, wait, I'm in a cubicle, or I'm in a building and there's other people in here. We have to wear a mask the whole time. The state actually does a really good job on their Q&A site of detailing out those questions you might ask. What's considered an indoor space? What about a cubicle? What if I put a shower curtain up? What if I do this? And their answers are pretty clear. So if you need any help directing to that site, just let me know, and I'm happy to send you the link. We have another question that came in about a local rec center that has stopped taking temperatures for anyone other than staff. They were told that this was a county guideline. Is this correct?
There's no requirement for any business to screen their patrons. So not to say that you couldn't have some means to inform your patrons that they shouldn't be coming there ill, but the requirements of the order are specifically for employees. So rec centers are not required to screen all of their patrons. No business is required to screen all their patrons. Again, not to say that they couldn't have something like that, but it is not required.
except for maybe personal services and some of those, there are some requirements in some of those other industries.
Yeah, when you get into some of the health settings where people are not going to have a mask on, I think they are doing screenings for some of that.
But they have to have clear signage, mask wearing required, and then we have signage that encourages, please don't come in if you're sick. 100.4, if you have cough, please don't come in. And this person said, thank you. Are there any other questions for Lane today? Again, I'll send out, he's going to send us that presentation. I've gotten a couple requests for it this week. Send us that presentation. I'll send out testing results, testing sites, travel advice. I'll send out the new mask orders for City of Boulder and City of Louisville, just so that those are readily available. And then the regular updates that we normally have. All right, well, everybody has 34 minutes to their time, and I'll see everybody next week. Again, stay safe, stay healthy. There are other viruses out there, believe me. So if you're sick, stay home, and we hope that everybody continues to get your questions answered and, continues to stay healthy, and, our businesses continue to stay open. Thank you, and have a wonderful weekend.
Thank you.